Good afternoon, everyone.
Good afternoon.
I'm Rebecca Warren. I'm State Senator from Washtenaw County, and it's my pleasure to welcome you here to our press conference as we commemorate the 42nd anniversary of the Roe v. Wade decision. As we celebrate today, we must remember that Roe is not just about a court decision, and it's not even just about abortion. Today, we commemorate a decision that changed the course of history for women in this country, ensuring that we have the right to control our bodies, our private healthcare decisions, and ultimately, our destinies. This day is about remembering the women who were once forced to seek extreme options in very dire circumstances, and vowing that we will not put women and girls in that same situation today by chipping away at that fundamental right. We celebrate this anniversary by trusting women to make the healthcare, education, and employment decisions that are best for them and their families, by recognizing that each individual woman alone is in the best position, is best equipped to decide whether or when to become a mother. We celebrate this anniversary by continuing to fight to ensure this right is never taken away from us, our nieces, our daughters, or granddaughters. We must continue to fight because during the last legislative session in this Capitol, over 50 bills were introduced whose single purpose was to restrict access to safe and legal reproductive options. We must continue to fight because 86% of Michigan counties have no abortion provider. A woman must now purchase a separate rider to have full gender equity in her insurance coverage. And because last year, a bill package was introduced that would make it a felony for a doctor to provide abortion after a fetal heartbeat was detected, which can be as early as 6 weeks, frankly, often before many women even know they are pregnant. We must continue to fight because a bill that would ensure that our children receive medically accurate, scientifically based, comprehensive sexuality education didn't even receive a hearing. But $800,000 was earmarked in the community health budget to support crisis pregnancy centers. And emergency contraception is still not readily available for survivors of sexual assault in our urgent care clinics and emergency rooms. No matter what side of the aisle you're on, we should all agree that infant mortality should not be the #1 killer of Detroit infants, and that 1 in 4 teenage girls should not have a sexually transmitted disease or infection. We should all agree that something needs to be done to provide the health care that Michigan's women and their families need and deserve. I can assure you that my resolve to fight is strong, and I'm looking forward to working with all my colleagues around me in the House on legislation that supports Michigan women and families and holds their health and safety paramount. And I'm happy to introduce one of those colleagues now, Representative Marsha Javi.
Thank you. Good afternoon, and thank all of you for being here, and all of my colleagues for being here and wearing pink on this special day. Thank you, Senator Warren. My name is Marsha Javi, and I'm the representative from Muskegon and other parts of Muskegon County. I've been passionate about women's health care all my life, all my adult life. I've been proud to be the director of Muskegon Area Planned Parenthood. And as such, we educated young women and women, others as well, and provided healthcare services to these women, often lower income, who wouldn't have been able to get their healthcare without our services. I've seen how critical healthcare is for the well-being of women and their families. And that's why I know how extremely important it is that the government not interfere in the relationship between the woman and her physician. Let us decide. Let the women whose lives it affects make the decision. Trust us. These are not decisions that lawmakers should ever make for another person. The majority of Americans agree. They don't want government making medical decisions for themselves or others. But so often, those who are against our right to make our own decisions try to legislate our rights away. These people talk a good game about how their laws would protect women, but in truth, all they do is limit our access to medical care and limit our ability to make our own decisions. Not only does this affect our health and well-being, but it affects the health and well-being of our families and the economic stability of our families. Here to talk about economic stability is Representative Gretchen Driscoll.
Thank you, Representative Hovey-Wright. Thank you. I'm glad to be here on this very auspicious occasion, recognizing the 42nd anniversary of Roe v. Wade. And I'm Gretchen Driscoll, as I was introduced, and I represent portions of Washtenaw County. I just want to say we can't have a conversation about women's health care without talking about economic security. As I'm sure you all know way too well, many Michiganders are struggling to make ends meet and have been for many years. We rank 41st in the nation for unemployment, and many working families are still dealing with stagnant and falling wages. Anyone who separates women's health care and economic security is disconnected from the real-world circumstances that women and their families face. For women, being able to decide when and whether to have children is critically important in their ability to support themselves and their families. As a matter of fact, a University of Michigan study shows that 1/3 of the wage gains women have made since the 1960s, when birth control was first brought forward, was the result of birth control. That's a very significant impact for all of us women, and it very much affects the economic security of not only women, but the women's families. Additionally, research shows that over a lifetime, women earn 3% more each year. That's 3% more each year they put off having a child. So the later you wait, obviously, if you're in your 20s and you have a baby earlier, it really negatively impacts your living wages. Employers who don't cover basic health care costs like contraception are denying women economic benefits that are provided for everyone else. When a woman can't get the medical care she needs because state law has put roadblocks in the way, her family and her children suffer. Too often, we see legislators playing political games with women's health under the guise of morality, when it's women and their family who pay the price. And I'd like to bring up Representative Christie Pagan to talk a little more about that.
Thank you, Representative Driscoll. My name is Christie Pagan. I'm the state representative from Canton, Van Buren Township in the city of Belleville. As Rep. Driscoll said, a woman's economic and well-being is directly connected to her ability to make her own medical decisions. Laws that restrict women's access to care may target reproductive health, but they also make women suffer economically. And laws that seek to regulate women's health care centers out of business not only interfere with reproductive choices, but put women's lives in danger too. For many lower-income women, centers such as Planned Parenthood have been the only place they could go to have breast or cervical cancer screenings. In 2010 alone, Planned Parenthood performed nearly 750,000 breast cancer screenings and nearly 800,000 Pap tests. These tests save women's lives and have a direct impact on detecting cancer early, where it can be treated most effectively and efficiently. I don't need to tell you about the overwhelmingly burden a life-threatening illness places on a family. Not only is it medically and emotionally a crisis, but the cost of care can put families onto the brink of bankruptcy. For all of these reasons, making sure that women have accessible, reliable, and safe, comprehensive health care is integral to our economic security. It's my pleasure to introduce my colleague, Representative Leslie Love, who will wrap up our program.
Thank you, Representative Pagan. My name is Leslie Love, and I represent parts of Northwest Detroit and all of Redford Township. I know that the issues we are talking about today are often called controversial, but really they are not. At least they shouldn't be. There is nothing controversial about a woman preventing cancer. Nearly all women between the ages of 15 and 44, 99% in fact, have used some form of birth control. So this isn't controversial anymore, or it shouldn't be. And while abortion may be controversial, preventing it should not be. Better access to health care and contraception prevents abortions. The abortion rate in 2011 was the lowest rate since 1973, and much of this decrease is attributed to improved contraception. Preventing abortion should be something we all can agree on. To women who need this care, this This is not a controversial issue. It's a matter of basic health care and economic equality. So instead of working to restrict women's rights and access to health care, lawmakers in Lansing should be working to help women and families. We must promote policies that reduce barriers to health care and instead make health care more affordable and accessible. It is an issue that is central not only to the health, but the economic well-being of Michigan women and their families. It is an issue that is central and very important, that it is what we all as legislators are working towards. Because we know that when Michigan women prosper, all of Michigan prospers. And that's all I have to say about that. Thank you.